The jab cross, also known as the 1-2, is one of the most basic and fundamental punching combinations in boxing and mixed martial arts. A wide variety of muscles throughout the whole kinetic chain are needed to perform this movement correctly. Some of the joints that are responsible for this movement are the hand and wrist, elbow, shoulder girdle, and the trunk and spine. The jab cross moves along the sagittal plane and frontal axis, as well as the transverse plane and vertical axis due to the rotation. Now, let's slow things down and take a closer look. One of the most important joints utilized in the jab cross is the hand and wrist. The wrist is a condyloid joint which integrates the radius, ulna, and carpal bones, while the fingers used in the hand are ganglimus joints which integrates the carpals, metacarpals, and phalanges. The primary movement performed by the wrist is an isometric contraction of the flexors and extensors while the fingers stay in a flexed position. The flexors of the wrist that are engaged are the flexor carpi radialis, flexor carpi ulnaris, and the palmaris longus. These muscles are the agonists when it comes to wrist flexion, while the finger flexors are going to help with wrist flexion. The finger flexors are the flexor digitorum superficialis, flexor digitorum profundus, and the flexor pollicus longus. The extensors of the wrist, which are the extensor carpi radialis and the extensor carpi ulnaris, stay in an isometric contraction to maintain the neutral wrist position necessary for a jab cross. However, the finger extensors are not active since the muscles of the hand are being flexed into the fist position.
Next joint being analyzed will be the elbow joint. The elbow joint is a ganglimus or hinge joint, and the bones related to the joint are the ulna, radius, and humerus. When analyzing the elbow joint in the preparatory phase, the main action is flexion. The flexors of the elbow are the biceps brachii, both long and short head, brachialis, brachioradialis, and the pronator teres. The biceps brachii are the prime movers of flexion, and the brachialis is a synergist. The pronator teres is also a weak flexor of the elbow. All the muscles are in an isometric contraction during this phase. In the execution phase, the two actions that occur are extension and pronation. The main muscles of extension are the triceps, long head, lateral head, and medial head, and the anconeus. The muscles of pronation are the pronator teres, pronator quadratus, and the brachioradialis. Since the elbow joint is in a neutral position, the brachioradialis will pronate as well. When throwing a jab, extension occurs as well as pronation while the right arm stays isometric. The same will occur with the right cross while the left arm is isometric. When the two punches are thrown, triceps and pronators are concentrically contracted. Once the execution phase comes to an end, the recovery phase begins. The two actions that occur are flexion and a slight supination. The muscles for supination are the supinator and the brachioradialis. Because we will return to a neutral position with our elbow in flexion, the brachioradialis supinates as well. After executing the jab cross, we are recovering from extension. When recovering from extension, both the flexors and supinators will be concentric, moving to an isometric state. This recovery will occur for both the left jab and right cross.
Moving on to the next joint of topic, we will be analyzing the shoulder girdle with respects to both the left and right side. The shoulder girdle is best described as a diarthrodial joint, meaning that it is freely movable. The bones that are associated with the shoulder girdle are the scapula and the clavicle. When analyzing the preparatory phase of our participant, the left arm is the lead arm as it sets up for the jab. The left shoulder girdle is in slight protraction, helping to properly position the lead hand for the jab. The left side is isometrically contracted with the serratus as the acting agonist muscle and the pectoralis minor acting as a synergist in the movement. The right shoulder girdle is set slightly different due to the cross part of the movement. The girdle is isometrically retracted as the rhomboids act as the agonist muscle group, and the mid to lower trapezius muscles are the synergists in the retraction. Furthermore, the right side is downwardly rotated to help load the muscles to produce a greater force. This is done primarily through the rhomboids with the help of the pec minor, while both are isometrically contracted. During the execution phase is where we begin to see our movement come to life. It is during this phase that the left shoulder girdle is put in slight elevation due to the help of the upper trapezius and levator scapulae as the agonists and the rhomboids as the synergists. As the execution phase progresses, the girdle begins to contract. The primary muscles involved in this motion would be the serratus, and the secondary muscles in this action, the pectoralis minor. All the given muscles are concentrically contracted throughout this part of the movement. These actions and contractions are the same when looking at the cross part of the movement on the right side. Lastly, the recovery phase of the shoulder girdle consists of oppositional actions from the execution phase. It is in this phase that we see both the left and right shoulder girdle slightly depressed and retracted. The muscles involved in the depression of the girdle are the lower trapezius, pectoralis minor, and the subclavius. The lower trapezius acts as the leading agonist, and the synergists are the pectoralis minor and subclavius. Shoulder girdle retraction is made possible through the trapezius as the agonist and the rhomboids as the synergist. All the muscles responsible for these actions are concentrically contracted.
Now we will move into the analysis of the trunk and spine. In the preparatory phase of the jab cross, the muscles of the trunk and spine are in an isometric contraction. Lumbar rotation occurs on both the left and right sides of the trunk in the transverse plane along the vertical axis. The spine also rotates to the left and to the right. There are three agonist muscles in the lumbar rotation: the rectus abdominis, the external oblique, and the internal oblique. In the posterior spine, the rector spinae iliocostalis, longissimus, and spinalis are in an isometric contraction, along with the quadratus lumborum to maintain the neutral spine. As a jab is being thrown, the core rotates towards the right, in which the right internal oblique and left external oblique is in a concentric contraction. As the cross is being thrown, the core rotates towards the left, in which the left internal oblique and right external oblique is in a concentric contraction. The transverse abdominis concentrically contracts with each punch. Core muscles on the posterior side stay in an isometric contraction during the recovery phase.